A lot of patients ask me, Dr. Kim, I want to change the shape of my nose. What does that mean for you, the patient? And how can we help you achieve your rhinoplasty goals? Let's get into today's episode.
You Are Beautiful, podcast with Jae Kim, ND.
Thank you for tuning in to the You Are Beautiful podcast with Jae Kim, MD. I'm your host, Dr. Jae Kim, a double board certified facial plastic surgeon, and I'm on a mission to make the world a more beautiful place, starting with you. There are 3 undeniable truths that you must embrace in your heart to start this beauty journey. The first is that you are beautiful. The second is that you are unique. And the third is that you are worth it. Let's get into today's topic, rhinoplasty. The goal of this episode is to go over all the considerations you may have leading up to signing up for a rhinoplasty surgery. As you probably know, rhinoplasty is what we call a nose job. And this is a surgery to change the shape of your nose. This is a very important surgery for me because as a facial plastic surgeon, I understand how integral the appearance of your nose is to the overall beauty and aesthetic of your face. This can help you look wonderful and feel really confident about your beauty, or it can really hamper your confidence and your perception of beauty. Here are some of the more common reasons that people want to change the shape of their nose. The most common reason that I hear is that there's a bump on the bridge of the nose. This bump can be something that you're born with, or it can develop over time, maybe after a result of an injury. Another common ask that I get from patients is that they want to change the tip of their nose. There are various aspects to changing the tip of the nose, and some people can think that their tip is too round or bulbous, is the term that we call it, or that it is drooping down, or that it is too long or too short. So there are different parameters of the nasal tip that many patients ask for me to change. Other concerns that people may have about the shape of their nose, and this goes for usually non-Caucasian people, is that the bridge is too low. And so what you may have is a situation where you try to wear glasses or frames and the glasses keep sliding down because they're resting on your cheeks and not on the bridge of your nose. And so it's kind of annoying when you try to find glasses or sunglasses and you keep having to go like this. So it gets annoying when you try to wear glasses or sunglasses and you have to keep pushing up the glasses back onto the top of the bridge of your nose. And it just keeps sliding down. And especially when it's hot outside and you're getting sweaty, the glasses slide down even more easily. Other requests when it comes to rhinoplasty surgery include changing the size of the nostrils or the width of the nose, which go hand in hand. The other concern is that the nose might be crooked. And often with a crooked nose, what you see is that patients may not breathe well from one side of the nose or both. Again, this can be related to how your nose was when you were born, but other times it can be related to injuries, even minor ones. The important thing to remember about your nose is that it serves 4 functions. The first is that you breathe through your nose. Now, remember the last time you had a plugged nose because of a cold or a sinus issue? How tiring is it to breathe through your mouth? If you're watching this on YouTube, mouth breathing is very uncomfortable. The thing about your nose is that it provides a little resistance for the air that you breathe so that it feels like a really good breath when the air goes from out here all the way down into your lungs. So you need that narrowness of your nasal passages to get the air from the outside all the way into the alveoli. So when you go like this, how good does that feel? So just the way that your nose is shaped and your nasal passages are, it's very important when you take a good deep breath in and out. So when it comes to breathing and rhinoplasty, I want to make sure that no matter what changes we make to the shape of your nose, that your nose breathes as well or better than before surgery. This is especially common with crooked noses or with deviated septum. You may have heard from your doctor that you have a deviated septum. In that case, part of what I do as a rhinoplasty surgeon is address the deviated septum as well so that you can breathe well through the nose and you have a cute, nice looking nose at the end of surgery also. The second function of the nose is defense. So whatever is out here in the air that you breathe, it has to enter into your lungs. And the nose is a line of defense against any germs that might be in the air that you breathe. We know this all too well after the pandemic. Our nose is crucial to our body's defense system. If there's something in the air that you breathe in that your body needs to defend against, your nose is that first line of defense. And so the immune defense functions of the nose need to work well. The third function of the nose is olfaction or smelling. One of the more common ways that we derive enjoyment out of smell is food. Obviously, I like different types of food. So when I think about, oh, if I couldn't smell, I would not be able to enjoy food. Smell is very closely tied with taste. If you cannot smell, you cannot taste. So that's one of the things that is very important when it comes to the function of your nose. On a more basic level, our sense of smell is important for our survival. There are many animal species that rely on smell to find their food, to find mates, and other very important life functions. The fourth and final function of the nose, and the one that we are most concerned about in today's episode, is our aesthetic. Now, some people say that I want my nose to be pointy, I want my nose to be rotated a certain amount, I want my nose to be symmetrical, those kinds of things. I would submit to you that the less you are focused on your nose when you look in the mirror, it's actually a good indication that the nose shape and size fit into your overall facial aesthetic. So let me repeat that in a different way. If when you look in the mirror, the first thing you see is not your nose, that's actually a good thing. The first thing you'd rather see in the mirror are often your eyes or your lips, because this is how you communicate your beauty to the world. So now that we've reviewed the 4 functions of the nose, let's move on to how you would choose your rhinoplasty surgeon. This is very important because rhinoplasty is one of the most requested and performed surgeries in the US in terms of cosmetic or plastic surgery. It has been that way for quite a long time and will continue to be that way. I think this is because our noses are very unique. And my second core mantra, you are unique, is closely tied to your beauty and how your nose fits into that beauty. So if your appearance, if your beauty is unique, of course your nose is not going to be like anybody else's. As a patient, there are several things to consider when you choose your rhinoplasty surgeon. One of the important things to consider is their board certification. Is your surgeon certified by the Board of Plastic Surgery or Board of Facial Plastic Reconstructive Surgery? I would say that that is a good criterion to start with. These are surgeons throughout the country and even across the world who have properly learned the techniques of rhinoplasty, how to approach it, how to take care of you during the procedure and in the aftercare as well. So make sure that your surgeon is certified by one of these 2 boards, the American Board of Plastic Surgery or the American Board of Facial Plastic Reconstructive Surgery. I personally am board certified by the American Board of Facial Plastic and Reconstructive Surgery. And this is a long process getting certified by one of these 2 boards because you have to finish your training, you have to do a certain number of cases, you have to pass a very rigorous exam situation. So these certifications are very important when it comes to choosing your rhinoplasty surgeon. The next thing to consider is how this surgeon makes you feel during the consultation. One of the things I always tell my patients is, what is on your mind? How would you like to change the shape of your nose? What is the thing that bothers you the most about your nose? This conversation should be about you and your nose, and not about your surgeon. Yes, choosing a qualified surgeon is important, but I would argue that feeling heard, feeling understood in your consultation is vitally important to achieving a great rhinoplasty outcome. If you are just another person in an assembly line of rhinoplasty surgeries, how would that make you feel? It's not a personalized approach to your nose, and yet one of the core tenets here is that you are unique. If you don't feel like your nose, your situation, your surgical goals are unique, then it will likely not lead to a great outcome. In terms of the surgery, it might, but in terms of how you are trying to achieve a more beautiful version of you with rhinoplasty, that may not be the best way to approach it. I always ask people, do you have any questions? And one of the reasons why I make episodes like this is to try to give some education and some feedback based on what people commonly ask me when it comes to different facial surgery. Another very important thing to consider is your surgeon's before and after photos. Are any of these before and after photos resonating with the concerns about my nose and what I would like to do to change the shape of my nose? A surgeon may have thousands of before and afters, but none of the before pictures look like your nose or resonate with your rhinoplasty goals. I say this particularly in the context of non-Caucasian rhinoplasty. So when you look at surgeons who do many, many rhinoplasties, many of them operate on a lot of Caucasian patients. Now, if you are a non-Caucasian person, you may be looking to do rhinoplasty with another surgeon who specializes in your ethnicity. And so when it comes to Asian or Latino or Black rhinoplasty, you may want to go to a surgeon who does a lot of procedures for that population. In particular, I see a lot of Caucasian patients and a lot of Asian patients for their rhinoplasties. And so the considerations in terms of the anatomy, the common requests, the goals, the healing process, these are all a little bit different based on our ethnic background. So if you are an Asian person looking to pursue rhinoplasty surgery, you would likely go for a doctor who performs a lot of rhinoplasty for Asian patients. And in that before and after gallery, you may see somebody whose nose is like yours in their before image and is similar to what you would like to achieve as a part of your surgery. Another thing to consider when choosing your rhinoplasty surgeon is where they operate. You don't want somebody operating in the back of a nail salon. No discredit to nail salons, but there are safety standards that have to be met when you are considering a facility where your surgeon performs rhinoplasty. Your surgeon can operate at an ambulatory surgery center that is accredited and up to date, or your surgeon can operate for you at a hospital setting. Regardless, the care on the day of surgery at this surgical center or hospital where you have your surgery, it's vitally important that they take good care of you. And so this is the facility staff, the anesthesia team, the pre-op and post-op team. They're all vitally important in helping you on that day achieve a very successful outcome and in a safe manner. This should go without say, but unfortunately, I do have to say that you have to make sure that your surgeon is the surgeon doing the operation. It saddens me to say that there are situations where the surgeon you meet with when discussing your surgery ultimately is not the person who does your surgery. And thankfully, this is not so common, at least in the United States. But elsewhere in the world, it's kind of the wild, wild west when it comes to who performs your surgery. And we've heard of things like ghost surgeons, where the surgeon you meet with hires a mercenary or a minion or whatever you want to call it to do the actual operation. And this is unfortunately a scheme to increase surgical volume and revenue. However, if that were you, the patient, what would you think? It's kind of the I'm in an assembly line and people I don't know or haven't met are changing the shape of my nose. This is not just for rhinoplasty, but for other surgeries as well, is that you want the person with whom you trusted your time and effort and investment to be doing the actual operation. So, unfortunately, that's something you have to know and consider. And if you ask your surgeon, hey, are you the one performing the surgery? And if they don't say yes immediately, you might want to reconsider. Okay, so you've decided on a surgeon. Now it's time to go have a consultation. You can have this meeting with your surgeon virtually or in person. And there are many rhinoplasty surgeons, including myself, who see patients from out of town. So for us in the DC metro area, I see patients from the surrounding neighborhoods, but also there are patients from other parts of the country who come specifically for me and for my services. And it's a great honor and privilege to help you with that, even if you don't live nearby. So, regardless of wherever you're coming from, you want your surgeon's office staff to accommodate your situation. So, this is arranging the telehealth visit. This is arranging the travel accommodations for when you come in for surgery and making sure that you have a smooth process from before the surgery, the day of, as well as the aftercare. In consultation, one of the main things that I want to learn about you is your motivation for undergoing rhinoplasty surgery. The shape of your nose may be a sore spot for you in terms of your self perception of your appearance, in terms of how you think other people see you, and the desire to change the shape of your nose can really be life changing. I want to make sure that your motivation for undergoing surgery is a healthy one. The thing about a healthy motivation is that almost always it's for something within yourself. If you are trying to please someone else by changing the shape of your nose, you are subjecting yourself to the whims of that person's emotions and desires. And that's something that you cannot control. There are enough things in life that we cannot control. So if you're trying to do this for somebody else, you're definitely not going to be happy. So consider this very strongly when you think about your motivation for pursuing a rhinoplasty. I see this with younger patients sometimes. You can have a high schooler or a young college student come in with their parents, and we undergo the consultation. And during the consult, it seems like the parents are pushing for the surgery more than the patient is. So sometimes it behooves me to speak to the patient one to one without the voices of the family trying to influence the situation, to say, hey, this is your nose. Ultimately, this is your life. What are your thoughts about it? And again, this goes back to helping the patient feel seen and heard and understood. The nose is the center of the middle of your face, so there is no avoiding your looking at it every single day. How are you going to live with this nose? If this is the nose your parents wanted, once you leave your parents' nest, how are you going to feel about your nose? This is something for you to consider. Now, many of the teenagers and young adults I see are very mature. And when they talk about the shape of their nose and their goals and their motivations, it comes from a very healthy place. And so that's something that is very reassuring to me, that this person is doing it for the right reasons, and we're going to have a great outcome. Another important aspect of the consultation is my actual examination of your nose. There are certain goals that you may want to achieve regarding the appearance of your nose, but if they are in conflict with, among other things, your breathing or your cultural background, I may shift the goal a little bit to say, hey, maybe this exact appearance or this size of your nose is not the best for your breathing or for your overall gestalt. Instead, how about we go this way instead of that way? And so these small pivots can occur in our conversations. The thing is, I want us to have a productive dialogue where you trust my expertise and I trust what you would like for your nose so that we can come to an agreement about the best way to move forward with the surgery. Regarding the health of your nose, some things you have to tell me are prior injuries, prior surgeries, any drugs through the nose, any smoking, any vaping, any marijuana, things like that. These are very important things to know and consider when we want to have the best outcome for your rhinoplasty surgery. If I can just say a few words about smoking, smoking is very deleterious to the recovery process after rhinoplasty. Nicotine in particular, what it does is it restricts the growth of the tiny blood vessels that are vitally important to the healing process. In a very delicate area such as the nose, you need every last little bit of vasculature to be optimally healing your nose tissues. So if nicotine is getting in the way of that, I may refuse to do surgery for you so as to help preserve the health of your nose. The thing about smoking is that nicotine can stay in your system for quite a while, even after your last cigarette. So in general, I recommend to be off cigarettes, any nicotine product, 4 weeks before and 4 weeks after. This will help optimize your recovery process. This is especially important if you are considering a revision rhinoplasty, because there is more scar tissue which gets in the way of neovascularization or blood vessels forming into the surgical area. So this is vitally important for rhinoplasty, especially if you're undergoing a second or third rhinoplasty. A common question that I get is, Dr. Kim, are there going to be any scars on the outside of my nose? And this is a good question to answer by telling you about the two main types of rhinoplasty. The first, which does involve a scar along the nostrils, is called an open rhinoplasty. And what I do is I make a upside down V incision across the nostrils. And the reason that it's not a straight line is so that it will hide better. People ask me if it will show in the end. I have had to revise one or two scars in hundreds and thousands of rhinoplasties. So in general, no, it does not show. The scar heals quite well. Number one, because it's not a straight line. And number two, it's hidden from the sun. Because it's under the shadow of your nose, it's not going to be exposed to the sunlight and be subject to scarring due to oxidative damage from UV light as much as other parts of the facial shape. The main advantage of open rhinoplasty, so one that requires an incision across the nostrils, is that the surgeon is able to visualize all the nasal skeletons more clearly. The potential downside is that the surgery might take longer and the swelling after surgery may last longer or be more intense. So the other approach is what we call a closed rhinoplasty, where all of the incisions are made inside the nostrils and there are no visible incisions along the base of the nostrils. The main benefit of closed rhinoplasty is that the operating time might be shorter. The potential downside is that some maneuvers or some shape changes may be a little tougher to achieve with closed rhinoplasty compared to open rhinoplasty. I prefer both the open approach and the closed approach, depending on your anatomy and your specific goals. So now you've decided to move forward with rhinoplasty surgery. What can you do to have the best experience through this day of surgery and through the recovery process? So preparing for rhinoplasty is something that requires physical, mental, and emotional preparation. The first thing to do is reinforce your support system. Undergoing rhinoplasty and recovery is a difficult process. And so it always helps to have someone by your side, even to get something from your refrigerator, or even drive you from place to place and help run errands for you. So if it's family, if it's a good friend, just make sure that they're on board and that they're there to help you during the day of surgery and the recovery process. The second thing to do is to trust in your surgeon and in the team taking care of you. As a double board certified facial plastic surgeon, I have performed many rhinoplasties, and I have had many patients with great results who are very happy with the outcome. Yes, the prospect of surgery can be daunting, and there can be a little bit of a fear of the unknown in terms of the outcome. But rest assured that I will do everything in my power to do the best operation for you on the day, and I trust that you will do everything in your power to follow the post-op care rules and guidelines so that you have the best outcome. The third thing to consider is to eat healthy leading up to the day of surgery. Two things in particular: eat healthy proteins, like lean meats, and then eat a lot of antioxidants. So fruits and berries, particularly, are rich with antioxidants to help with the healing process. One thing I tell patients to do is to actually eat some pineapple. And you can start eating pineapple a few days before surgery and through especially the first week of the recovery process. Pineapple contains an enzyme called bromelain, and bromelain decreases bruising and swelling. So don't drink pineapple juice because you may lose the efficacy of the enzyme in the juicing process. Actually get the fruit, which is going to be better for your healing. The fourth thing to do is to actually stop certain medications and supplements. Even something like omega-3 fatty acids, which are good for our heart, can be a hindrance in terms of the surgery and the recovery because it makes you a little more likely to bleed and ooze. So intraoperatively, I've noticed that some patients whose cases are a little bit bloodier than others, you ask after the fact and they said, oh, I continued my omega-3s leading up to surgery. And so that's kind of where that ends up, is that even supplements, which most people would consider harmless, can lead to a bumpier ride in terms of the day of surgery and in terms of the outcome. If you are on blood thinners or antiplatelet agents for your heart health, you'll want to talk with your primary doctor or even your cardiologist about when to stop the medication before surgery and when to restart. So in terms of surgery, any medication that makes you more prone to bleeding or oozing is not helpful for the operation and for the outcome. However, you have to balance that between your heart health. So again, talk to your primary doctor or your cardiologist about when to stop and restart your medication. These medications include aspirin, Plavix, warfarin, Eliquis, and the like. For a complete list of medications to avoid, we'll have a link in the description. So the day of surgery has come. You meet with your surgeon in the preoperative waiting area, and you go over again your goals for the operation, any risks that you need to know about, and kind of the first few days of recovery, kind of what to expect and how to take care of your nose. For the vast majority of rhinoplasty surgeons, the patients are under general anesthesia with a breathing tube, and this is how I perform rhinoplasty surgery as well. The risks of anesthesia when it comes to rhinoplasty surgery are very minimal, especially if you are in good health. So the operation will take a couple hours and you will go home that day. You're not going to stay at a medical facility. You'll be at home or in your hotel. During the first week or so after your surgery, you may have a dressing on top of your nose along with tape, as well as splints inside. If you have an open rhinoplasty, you may have a few stitches between the nostrils. This all gets removed at your postoperative visit on day 6 or day 7 after your surgery. During the first week after surgery, you can expect the following. You can expect stuffiness and some swelling for about a week. The stuffiness comes from kind of mucus buildup in the nose. And for that, I always give my patients a nasal rinse. So you can use a neti pot if you like, but I prefer an actual squeeze bottle where there is some pressure to the saline solution to help wash out the mucus buildup that's in your nose. Sometimes, along with the swelling around the nose, there may be a little bit of bruising, and that can occur if we have to reposition your bones during the surgery. Repositioning the bones during surgery can happen if you have a crooked nose or if you have a big bump on your nose. For the first 4 weeks, I'm going to ask you to not wear glasses if you normally do, and also to refrain from your full tilt exercise routine. I will ask you, however, to walk around the house, walk around the block every day because you do not want to be bedridden after surgery. A lack of mobility or lack of ambulation after surgery can lead to a less successful recovery. In terms of sleep, sleep may be uncomfortable after rhinoplasty because your nose is stuffy. If you remember mouth breathing last time you had a cold, it's especially difficult when you sleep because your mouth gets dry, you need to wake up, drink water. Then when you drink water during the night, you have to pee. And since you pee during the night, you didn't sleep well. So these are some of the things to consider when you're undergoing this recovery process. And that's why it helps to try to wash out your nose with the irrigation bottle so that you can breathe at least a little bit through the nose during the recovery process. So when can you expect the final rhinoplasty result? In terms of downtime and recovery, you can expect about a week. Now, even after a week, you can't go back to your full exercise like I mentioned before. That has to wait 4 weeks. In terms of realizing the final outcome, usually you get a semblance of the final outcome at about the 4 to 6 week mark after a good amount of the swelling has gone away. However, in the 3 to 6 to 9 month period, you still may experience some ebb and flow in terms of the swelling of the nose. Some mornings you may feel more swollen than others, and that's totally normal. So when it comes to kind of the full recovery, usually patients, it takes about a year, sometimes 15 months. Depending on the extent of the surgery, or if this is not your first surgery, that can take longer, sometimes 18 months, sometimes 2 years. The thing is, the nose is a tip of your body, and whenever there is healing going on a tip of your body, it usually takes longer for that U-turn of healing to go away. So a fingertip, for example, or a nose or an ear, the lymphatic drainage, it usually takes longer to remove it from that area of your body. This is not to say that people will look at your swollen nose 8 months after surgery and wonder what the heck happened. The majority of the swelling of the nose that might make people do a double take when they see you is gone by about the 2 week mark. So you can still go about your normal life, even at 2 or 3 weeks after surgery, without somebody saying, oh, something happened to your nose. Like other surgeries, rhinoplasty comes with certain risks. These risks are rare, but you need to know about them so that if it were to happen to you, you know how you and your surgeon are going to get through that situation. One of the more common things that could happen is bleeding after surgery. Now, because our nose has so much blood flow, there's going to be a little bit of drip, maybe a day after. If it lasts longer than a day, or if it's more than a drip, just call me. I'm always ready to take care of that situation for you. Another thing that could happen is that you may breathe worse than when you started. Usually that's not the case because there are ways to help minimize the risk of poor nasal breathing. But if that happens, we're going to figure out how to make that better for you. Something that people do not expect that can happen is that there can be a little bit of numbness around the roof of your mouth. And that goes with the septal work that often happens in rhinoplasty surgery. If that happens, it will go away. It's a self-limiting issue and it goes away at about the 2 or 3 month mark. Every rhinoplasty surgeon who performs enough surgery will say, I have some people who are not happy with the outcome and want a revision. If you have a surgeon who says, I have a 0% revision rate, then they're lying or they're not doing enough surgery. So I always tell people that there is a small chance that you may want a second surgery. And I say this before I ever perform the first surgery. This is to set expectations so that you're not disappointed if, on the rare occasion, you might want a little tweak to your rhinoplasty surgery. In the end, rhinoplasty is a very personal decision for you. And I respect that every patient has different goals, desires when it comes to the shape of their nose. And so I respect what you have to bring in terms of your desired outcome. And I will bring my expertise in terms of how I can best help you achieve that outcome while maintaining or improving the function of your nose as well. To learn more and schedule a consultation with me about your desired rhinoplasty, use the website link down below, and I'll be more than happy to meet with you to discuss your rhinoplasty goals. Thank you for tuning in to today's episode of the You Are Beautiful podcast with Jae Kim, MD. If you want the free outline of this episode, please click the link down below. Again, remember these 3 core truths. The first is you are beautiful. The second is you are unique. And the third is you are worth it. Until the next episode, take care and stay beautiful.